Hey guys, Dr. Kevin here. Today we're going to talk about dog bites. Dog bites are super common. Every year, 340,000 emergency visits consist of dog bites. And we love dogs. Dogs are our best friends, but they can bite you. And a lot of times, it is the dogs biting their own owners.
Hey, what?
I'm going to tell you today what doctors do when you come in with a dog bite. First thing we do, we examine the wound. You clean it, you irrigate it with loads and loads of water so that you can see the extent of the injury. Most of the time, these injuries, they're somewhat clean. But if there are devitalized tissues or things stuck inside, we gotta get them out. Imaging is helpful if the wound is really big or if the bite is really nasty. And we do an imaging plain film to make sure there's nothing stuck inside. Next thing, dogs' mouths are nasty. You need to treat them with antibiotics. Most commonly, augmented. If you're allergic to amoxicillin, penicillin, we might try clindamycin and other medications. Tetanus is another prevention that's important. If you had all your tetanus shot as a child, great. But if your wound is really dirty, you gotta make sure it's up to date within 5 years. If it's not so dirty, 10 years. If you never had shots and it's super dirty, then you not only need vaccines, you also need immunoglobulins to actively treat these tetanus. Most of the times, you don't need rabies prophylaxis. Lastly, how do you fix that wound? Most of the time is if it's very tiny, we'll fix it with a suture. If it's so tiny it doesn't need a suture, great, just leave it alone and it'll heal on its own. Sometimes when it's really big and really nasty, we can't close it, and that is to allow pus to come out so that it can drain. So these are the quick general principles of treatment for dog bites. We still love them, but be careful. You know what to do if you get bitten. If you like this video, please like and subscribe. Thank you for your support.